Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forensic Medicine and today we will continue with mechanical asphyxia. In today's video, we will discuss about suffocation. Suffocation is a form of asphyxia caused by mechanical obstruction to air passages due to causes other than the constriction of neck. So any mechanical obstruction to the air passages, which may include like nose or a mouth or a pharynx or larynx, any air passages which is obstructed other than the constriction of neck. So if there is a constriction of neck, it includes like strangulation, it becomes a homicide, the hanging or strangulation. Other than that, if there is any obstruction which leads it comes under suffocation. Under suffocation, there are different forms like smothering, choking, gagging, overlaying, traumatic asphyxia, burking. Coming to one by one, first is smothering. So smothering is a form of asphyxia caused by mechanical occlusion of external air passages, that is nose and mouth by hand, cloth, plastic bag or any other material. So here peculiarly the nose and mouth is obstructed. So smothering includes any air passages. Smothering is specific external air passages, mainly the nose and mouth. It may be closed by hand or hand, like combination of nose and mouth. It is nose is pinched and mouth is closed, or some other material like pillow can also be closed, or plastic bag can also be used to close the nose and mouth. In suffocation, smothering, there may be abrasion and bruises may be formed around the nose if the person's nose is occluded by hand. If other material like pillow is used, no signs are seen, no signs of abrasions are seen. Injuries at the inside of the lips from pressure of the teeth are seen, since the person may try to open his mouth during that procedure. There may be injury in the underside of the lip may be present. Bruising of the gums and sometimes tears of delicate tissues are seen. So cheek under the cheek gums may be also be injured because the person is trying to struggle to open the mouth, which may lead to bleeding. Other than that, there are other signs of asphyxia presence, which includes congestion of internal organs. Then there is cyanosis will be present. Then the petechial hemorrhages will also present. So these few signs of other signs of asphyxia will be seen. Medical importance of smothering. Suicide is very difficult. It's not possible. It can be done by forcibly placing a face on the nose and mouth. Homicide is commonly seen by smothering. Can be done by incapacitating the person by drugs or alcohol. Accidental can be seen in children or infants who are weighed by clothes and weight of the clothes. If the children are playing in a household, suddenly the pile of cloth may fall down and may get smothered. By playing with the plastic man, they also get suffocated. And during breastfeeding, sometimes the mother may try to breastfeed in lying down position. That time she may fall asleep and fell on the kid and may lead to smothering. Now coming to next type of suffocation is the choking. So it is a form of asphyxia caused by obstruction within air passage. So here the obstruction is within the air passage. Nose and mouth is clear, but air passages are blocked by foreign object like a coin or a food, a candy or fish or any material can be there. It is a form of obstruction called obstruction within the air passages by a foreign object. In this mechanism, the suddenly because of obstruction of the air passage by some object, the person goes initially there is stridor, that is increase in respiration rate. Then respiratory distress is seen, coughing is seen, and inability to victim to speak. The person will be unable to speak. Afterwards, it is followed by rapid deep inhalation, which causes the foreign object to pass further down the air passage airway. Then there is laryngospasm occurring followed by vagus stimulation leading to arrhythmia, apnea, and death. So usually this is a common scene. Once the food get lost, there is a gag reflex, person try to cough, and it may lead to deep breathing. If the person goes and try to deep breathe because of force of air entry, again the bolus may enter, food bolus or upper energy may get obstructed into the air passage, leading to laryngospasms, followed by vagus stimulation may occur, leading to heart failure, heart stoppage, or because of obstruction to air passage, there may be apnea and person may die because of asphyxia. Cause of death in choking, mainly there is asphyxia, then maybe vagal inhibition as I mentioned. Stimulation of vagus nerve can, hence it, since it innervates the heart also, any stimulation of vagus nerve can cause reflex stoppage of heart. Then maybe laryngeal spasms the reflex construction of laryngeal muscles may cause the air passage to get obstructed and asphyxia may lead to that. Then there will be delayed death may occur. So delayed death may occur when the food bolus or obstruction is removed after the object is removed. The person may go for infections. So there may be some infection may be caused. There may be pneumonia, lung abscess, or bronchiectasis may lead to person may die because of delayed death after few days because of infection. Postmortem findings in case of choking. There are signs of asphyxiated death are seen. There is subconjunctival hemorrhages are present without any cutaneous petechiae. There may be presence of food or foreign body in the respiratory tract. That is object which is causing the choking is present in the foreign tract. The food items are usually round and firm and pliable to allow molding in the airway. In case the person has gone epileptic, sometimes the tongue itself can cause the choking. In that case, tongue may show bite marks and bruising may be seen. Almost any every case of choking is accidental. Suicide and homicide are also possible. Accidental choking death are common in children less than 1 year of age. 90% of choking occur within the 5 years of children. Homicide choking usually involves the aged individuals with diabetic conditions or who have tendency to drink or it may be intoxicated or in case of infants. In this case, object is forced into the mouth. Signs of struggle will be seen. If the individual was conscious, there may be signs of injury may be noted. In this case, there is oral teeth. In case of perioral teeth and tongue may get also seen. Intraoral injuries may be seen. Suicide choking is uncommon and may occur in psychiatric patients and prisoners. In the same thing, there is one more choking only. There is one more importance is cafe coronary. So cafe coronary is a condition of accidental choking where a bolus of food produces complete obstruction of larynx. It mimics heart attack, and usually seen in case of intoxicated person. Here, predisposing factors in cafe coronary is usually seen in cases of a person where there is decreased protective airway reflex. So since we have a protective gag reflex which tries to remove any bolus, if that gag reflex is suppressed by any means, such as if the person is aged, there is a poor dentition, person may try to swallow food as it is, or there is a ingestion of large dose of antidepressant, or person has consumed a lot of alcohol. In that cases, gag reflex may be suppressed because of that, sometimes the food may get obstructed. There may be one more lead cause, maybe the reflex cardiac arrest as a consequence of stimulation of laryngeal nerve endings from vagal inhibition may also be one of the predisposing cause. Main thing in cafe coronary is a visual scenario which is seen in any case of cafe coronary is person is healthy, intoxicated person. Intoxicated means the person is consumed alcohol in a hotel while eating suddenly turns blue, coughs violently, collapses and dies. This is a typical scenario in seen in cafe coronary. Person is healthy, as healthy as he is. He visits the hotel, have a lot of drinks. After few bites of food, suddenly turns blue, coughs and falls and dies. So this is the usual scenario in case of cafe coronary. Because he has intoxicated, gag reflex is suppressed, and the food may get lodged in the larynx, and person goes to dies. Other autopsy, large food bolus may be seen in the respiratory tract and laryngeal obstruction in the air passages. Treatment in case of choking. If there is a difficulty in breathing and cyanosis, first aid should be given mainly by pressure on the abdomen, which is called as Heimlich's maneuver, till the patient recovers or loses consciousness. A blow on the back or sternum may cause coughing and expelling the foreign body. The victim is placed in supine position and mouth is open to perform a finger sweep. So first, if the Heimlich maneuver doesn't work and blow on the back or sternum doesn't work, you can use the finger to try to remove the food bolus. If it is not successful, foreign body should be removed from hypopharynx, the middle and index finger with forceps. If the object cannot be removed, then the person may need to be tracheotomy, where hole can be inserted, incision should be done in the trachea and artificial respiration should be provided. Postmortem findings in choking. Mainly there is a bolus of unchewed food and such material is found impacted in the larynx or trachea or some other material may be present. Litmus paper test of bolus can be made to determine the acidity to ascertain whether it is from mouth or vomitus. If it is a vomitus, usually it will be acidic in nature. Coming to next form of suffocation is gagging. So gagging is a form of asphyxia which results from pushing a gag, that is rolled up cloth or a paper ball, into the mouth sufficiently deep to block the pharynx. It is a combination of smothering and choking. Though choking is deeper inside the pharynx, it obstructs the air passage. Gagging is just displaced into the mouth and pushed up till the pharynx. Initially, the airway may be patent through nose. Initially, the person may try to breathe through nose, but after a few minutes or few hours, there is collection of saliva, excessive mucus with edema of pharynx, and nasal mucosa causes complete obstruction. Post findings in gagging. The gag material which is used is present in the pharynx with surrounded by mucus, saliva, and other material. There is injury to the nose and mouth with seepage of blood into the back of the throat. Other signs of asphyxia like congestion of organs, cyanosis, then petechial hemorrhages will be seen. Next is the medical importance of gagging. Almost always it is homicidal. Victim is usually an infant or elderly person. Many times the gagging is usually resorted to prevent the victim from shouting for help. Death is usually unintentional. It can be caused, or it may be intentionally. Person may be gagged to cause death. Next form of suffocation is overlaying. In overlaying, there is compression suffocation results from compression of the chest, nose, and mouth so as to prevent breathing. So here the victim, there is nose, mouth, chest is all full, that is face and chest is completely compressed. So it is a form of accidental smothering of an infant by a nursing mother sharing a bed with her child who may roll over during sleep and occlude the air passage. This is typically seen in death of infants by overlaying by mother. She may over She may turn or roll over the infant and may cause the obstruction of the nose, mouth, and chest. It may be cause of intoxication. The mother may have been intoxicated, or she may have some medical condition which may suppress the arousal of the mother of crying, because of that the infant may die because of that. Postmortem findings in the post of overlaying: face, nose, and chest of the victim child may appear compressed and pale. Pressure marks from bedding and clothing may be seen on the victim. Usual findings of asphyxia seen in the will be present. It is purely accidental in nature. Medical aspects of overlaying is accidental, but it may be a case of it can also be a case of infanticide if there is a negligence of the mother negligence is proved. Next form of suffocation is traumatic asphyxia, also called as crus asphyxia. Here the asphyxia results from respiratory arrest due to mechanical fixation of chest. So here the nose and mouth is patent. So nose and mouth is open, but chest is unmovable. So the normal movement of chest will be prevented. Here the asphyxia is because respiratory arrest is due to mechanical fixation of chest. Chest is unable to move, so lung cannot expand, and the person goes with asphyxial death. Cause of traumatic asphyxia: common one is the house collapse accidentally, or in wars or earthquake. Because of earthquake or any reason, the walls may get collapsed on the person and lead to compression of the chest. There may be stampede by crowd, usually seen in temples, or in case of panic conditions in overcrowded areas like theaters or temples. Then outbreak of fire in cinema halls, public gatherings. In that case, stampede, that the person may be stamped by the over the crowd. The person may be run over by vehicle or overturned by vehicle. Because of that, there is compression of chest. There may be collapse of wall inside a mine or trenches in case of bunkers, sand, or grain. There may be train accident where the bogies of different trains fall over one other person. Person may be restrained in case of hog tying, a type of restraining of a person where hands and legs are tied behind the person. Hands and legs are tied behind the person, and the person may be in the supine prone position, leading to may not be able to breathe. Mechanism: there is fixation of thorax by severe compression, external pressure that prevents the respiratory movements. So because there is compression of the chest, there is compression, there is external pressure which prevents the movement of the respiratory movement is obstructed. A individual can die in seconds if there is a considerable wait, but usually it may last for 2 to 5 minutes before the death occurs. Postmortem findings, external findings. There is a classical sign of mass ecchymotico is seen. Here in this, it is a form where there is a florid red and blue congestion of face and neck with variable involvement of the upper thorax, back and arms. So typical florid red and blue congestion is seen in the face and neck. Then there is deep cyanosis of face is seen. Numerous petechial hemorrhages and ecchymosis are seen on the face and neck. There is a typical demarcation line is seen where there is level of compression is indicated by well-defined demarcation. So above the body, so at the chest and below the limbs. So above chest there is cyanosis will present, below chest the body will be normal. So demarcation line will be seen between discolored upper portion of the body and lower normal part. So above the part where the compression is present, it will be cyanosed. Below that, it will be normal. So this features will be seen, which is called as mask ecchymotic. Then there is the areas of pallors may be seen at the level of collar of shirts, fold and creases in the garments. There may be facial edema present. External blunt trauma injuries may be seen on the head, neck, and chest, along with mud or other foreign materials will be present. Internal findings: eyes will be retinopathy, retinal hemorrhages may be present in face, nose, ear, and pharyngeal petechias. Ecchymosis that may result from external bleeding may mix the basilar fracture. Bones, rib, and clavicle may be fractures are common. Extremity like pelvic fracture may also be seen. Upper respiratory tract, there may be edema, epiglottic, and range petechias may be seen. Lungs will be congested, heavy, subpleural hepatitis, contusion, lacerations, and hemothorax may be present. So because of chest movements fracture, the fractured ribs may lacerate the lungs, which may lead to pneumothorax. Also, there may be hemothorax may also be present. In heart, there may right heart and veins may above it may be distended. Injuries are rarely seen. Abdomen, hepatic and splenic laceration may be formed because of stampede. The person may person may force the abdomen, which may lead to laceration of liver and spleen. Edema and petechiae of sinus brain may also be seen. Medical aspect: it is mostly accidental, but fallen appliances of furniture, particularly over children, has been described as a mean of homicide. So any appliances may be thrown on the infant may try to kill the infant. Next form of suffocation is burking. It is a combination of homicidal smothering and traumatic asphyxia. This is a one form of condition where there is two involvement is present. There is smothering as well as traumatic asphyxia. It was done by William Burke and William Hare. These are the two brothers, William Burke and William Hare. They killed 16 persons during 1927-28 in Scotland and sold their bodies to Robert Knox for use as specimen in his anatomy classes in Edinburgh Medical School. So this is known as body snatchers, westbound murderers. The method of burking: here the victim was invited to their house and given alcohol. Once given alcohol, he will be intoxicated and will not be able to resist. When drunk, he was thrown on the ground, and Burke, the first brother, would kneel on or sit on the chest of the person and close the nose and the mouth with his hands. So he used to sit on the chest and close his nose and mouth, and here the other brother used to pull him around the room by feet. So this is how they used to do the used to kill the victims, which is now it is called as a burking. Those are the forms of suffocation. Other forms of suffocation other than the commonly seen, which doesn't include accident homicidal form, is the entrapment or environmental conditions. So in entrapment, it is a condition where the person is entrapped or present in the enclosed area devoid of oxygen. So in this condition, there is inadequate oxygen in the environment. It may be exclusively accidental in nature. People usually find themselves trapped in airtight or relatively airtight enclosures. As time passes, the oxygen present in that room may get reduced and person may die because of entrapment. Like person may stuck in some a mine or a room or certain condition, like a child may get stuck in the fridge and he may not able to come out of the fridge. Like that condition may be seen. Next is environmental suffocation. Here the individual is environmentally enters an area where there is gross deficiency of oxygen. So here the person is voluntarily or because of his work, he may enter some area where the oxygen is very low, and since the oxygen gets it may decrease so much so that the person may die because of deficiency of oxygen leading to asphyxia. Like the person may go for monitoring in high altitude areas, oxygen is very less, and in certain areas it will be so low that person may go for asphyxia. The person may work under sewage conditions where there is usually presence of other gases like H2S gases, and oxygen will be very less. In case of person working in mines, there also oxygen is very less and may get trapped if there is sudden accident and rocks may fall off. In both entrapment and environment suffocation, the cause of death cannot be determined since autopsy alone. There is no specific findings. There may be some visceral congestion may be seen that has a sign of asphyxia. It only by analysis of circumstances leading to an exclusion of other causes can that can be determined. These are my references. Thank you.